Did you know the very first dental implant was placed in 1965? Yes, that's right. Implants are not a new innovation. They've been around for much longer than any of us remember. Dental implants are the most aesthetic, realistic, and functional replacements for natural teeth. Implants might sound too good to be true. After all, they are strong, functional, and aesthetics with over 98% success rate. Most implants easily last 15 to 20 years without causing any problems. All you have to do to maintain them is maintain good oral hygiene. But you need to keep in mind, implants take time. You can't get implants whenever you want, as the whole treatment takes at least 3 to 6 months. To make sure you reap the benefits of implants without any complications, you have to be very cautious with the treatment. Some advantages of implants are: enable you to eat whatever you want, prevent degeneration of jawbones, keep remaining teeth in place and stable, prevent gum disease, prevent sagging of face and wrinkles. Your dental implant treatment will take multiple steps. It will start with a dental extraction where your dentist will remove any roots, debris left in the implant placement area. Following this, they will place the implant post in your jaw and leave it to heal and integrate with the jawbone over the next few months. Once this osseointegration process is complete, your dentist will attach an embutment screw over the implant post and use it to fix the crown or bridge. Finally, 2-3 weeks after the crown placement, your dentist will hold a follow-up appointment to make sure you don't have any residual problems and conclude the treatment. Book an appointment with the best dentist near you today for more information.